Okay, optic nerve, cranial nerve number 2. So, as you've all seen this before, this is your field of gaze. This is your left eye, your right eye. This is the optic chiasm, where it decussates across from the nasal field, and the radiation goes all the way backwards. So, just to get into your head, this is the temporal side of the retina, but the temporal side of the retina actually looks internally, so it looks nasally, whereas your nasal side of the retina actually looks temporally. So in a second we'll go through and I'll demonstrate to you what a bitemporal hemianopia is and what a homonymous hemianopia is. The temporal side of the retina looks nasally, but it goes straight the way backwards. So in order for you to look right, I'm actually using the temporal side of my left eye, which looks this way, and I'm looking at the nasal side of my right eye that looks that way. So the vision, if I'm staring straight over the camera, the vision looking that way, all this is coming straight onto the opposite side. The nasal side decussates across and comes all the way back down there. If you've got a lesion slap bang in the middle, of course the pituitary gland sits over there, so if you've got a craniopharyngioma, it will knock off both nasal sides of the retina. So you lose your peripheral field on both sides. That would give you this picture. See, as I'm looking ahead, if I've got a pituitary tumour slap bang in the middle, I would lose vision bitemporally, hence the expression bitemporal hemianopia. Hemianopia is half. So the internal bit is absolutely fine, because both temporal fields are seeing it. If we move down here, and let's say there's a stroke, if you've got a stroke on this side, look at which bits get knocked off. You lose your temporal side of the retina, which brings it nasally, and you also lose the nasal field, which looks temporally. Hence, you would get that. The other thing that the optic nerve does is visual fields. So if I use Gemma here, put your hand over one eye, get the patient to stare straight ahead at you, and you should be about a metre in between. Using your fingers, we're then going to assess all the way round, and you're assessing to see, using this, their temporal field and their nasal field. So if I put one hand over your eye, stare straight at me, can you see my fingers wiggle?
Yeah.
Now all the way round here, about half of that, I'm actually checking Gemma's nasal field, and that information would decussate across and go to this side of the brain. So that's all around there. As soon as I move internally, I'm now really using and assessing the temporal side of the retina to pick up the gaze on the inside. Is that fair now, all the way across?
Yeah.
No gaps?
No.
Good. Swap hands. Same again. Stare straight at my nose. Again, this is now checking her nasal field all the way around. As soon as you get on the inside, you're then checking the temporal that comes in this way. No problems?
No.
Good. Second cranial nerve.